Hello, welcome everyone to our webinar on birth preparation. And today we have Rebecca with us. Thank you so much, Rebecca, for your time and willing openly to share a little bit of your story and also go through birth preparation with us.
My pleasure. Thanks for asking.
Thank you. And I wonder if you can share a little bit about yourself, maybe introduce yourself, what you do, and a little bit of background about your pregnancy.
Yeah. Okay. Well, yeah. My pregnancy. I'm 41, and I decided to undergo IVF so that I can have a baby. I haven't met the love of my life yet, so decided that I didn't want to miss out on my opportunity. And after a couple of things, I was sort of told just before I turned 40 that I guess my fertility window was a bit shorter than anticipated. So yeah, just kind of started on that journey in about February last year, where I kind of started preparing myself and engaged with the IVF clinic and started saving. But also, I guess, started down the path of preparing myself, I guess, physically, mentally and emotionally to go through this. And I was really lucky that in, I think, August, September, I had my first treatment cycle following 6 months of acupuncture and Chinese medicine, and was really fortunate to fall pregnant on the first attempt, which was great. Yeah, I'm currently 36 weeks in 1 day. And I'd have to say I've had a pretty straightforward, non-complicated pregnancy, which is good considering everyone told me that I'd be, I mean, by fact of age and, I've had a Hashimoto's disease, that I'd be high risk. So, but certainly everything's been pretty straightforward so far. And yeah, that's my story.
Awesome. And thank you so much for sharing. And I know you're a health professional as well, and I know you've got different perspectives inside your head, I'm sure, as I could relate when I was going through my pregnancies. But I think your story is super special, and I know I've shared this with you on a face-to-face basis, but I think so many women will be able to relate to what you're saying right now. And straight away, I can think of women in our community who will benefit from listening to the fact that you went for it, the fact that you are where you are, and that it's possible. Like, it just generates so much hope and so much faith in the process and your own body, so well done, and thank you once again for sharing. So today we wanted to spend some time together. You are coming into the stage of your pregnancy where you're thinking about birth and preparation and having those discussions with your medical team as well. And as we're working together, our discussions are shifting towards that as well. So I've sent you a template for a birth preparation for you to have a look at. So I thought I'll run you through that, then you can add to it. We can both brainstorm together, go through different stages of labor together, and how you want to be best supported in labor and in the birth of your baby, first baby. And it is exciting times, but I think it's really important to take a moment and visualize how it will all come together, or how you would like it to come together. And I know some women sort of sit on the fence about planning. Some women do say to me openly that they don't think planning is great because they don't want to feel disappointed. My perspective on that, and I'm happy to hear your perspective as well, but my perspective on that is, it's not about having a plan that might not go to plan. It's exploring different options so that you have the clarity and that decision-making capacity now, when you can, to make certain decisions that if you had to make them in the middle of labor, you're a little bit more equipped. You're prepared to make that call, or you're making more of an aware, educated call on that decision. So what do you think about that? Do you feel like you're a bit more pro planning, or in between? How do you feel about that?
No, I'm pro planning, and I've always had kind of an idea in my mind of what I wanted for myself in a birth experience. You know, it's something that I've always wanted to be a mum, and I've always wanted to have the opportunity to go through a pregnancy and go through labour, and to be able to do that by myself as much as possible. You know, I haven't been scared about pain or anything like that. And I think at the moment it's even more important for me to be going through that planning, because I think with the current situation, with coronavirus and everything that's happened, I feel like a lot of my choices and things that I've wanted for myself have been taken away from me.
Yeah. Okay.
And so it is important to me to be really clear on the things that, you know, I can have some control over, and that I can ask for myself, and prepare for myself, so that ultimately that story doesn't come back to a virus and other people telling me what to do, or having an experience that's based on what other people chose for themselves. And I think that can be the difficult thing sometimes, is that you know, everybody's got their own story, and so they think they're being helpful, giving you advice of, oh yeah, but you know, I didn't worry about that, and oh, you need to listen to the doctors, because don't you realize that you're high risk and that this is the safest thing to do. And you know, it didn't worry me that I didn't feel it all myself, and that sort of thing. And you know, that's fine for other people if that's their choice, but this is something that I've spent 41 years wanting to experience, and I want to experience it my way. So for me it's important.
Yeah, that's really empowering, actually. And I think for women listening who may not be aware to what you are referring to in terms of choices, I think you're talking about perhaps more intervention and earlier intervention regarding what could be a normal pregnancy, not necessarily a high risk. Yeah, so there's definitely maybe discussions of that and different processes and procedures put in place. But I believe women more than ever should have that choice, and definitely stand up for it. So good on you. Yeah.
You know,
So
and I've worked in the health system. I know that there's, you know, there's a lot of stuff around risk mitigation and things like that, but I think it's really important to just advocate for, as an individual person, being able to have some choice and control over my health story in from whatever perspective I'm coming from. And this is kind of one of those situations, and it's, you know, this is something that we were built to do, and I want to give my body the opportunity to try that. So
yeah, it's amazing. It's amazing. And I think, yeah, good on you for it. So when I catch up with women for a birth preparation session, my conversation always starts the same. And this is about the environment that you can create for the labor. Now, part of the environment is, of course, location. And we know your location of birth now, and that's in terms of hospital setting. And you would have gone through a process to decide what your location would be as well, right? And usually I would say choosing a location, it has to feel safe. It has to be a place where you feel most comfortable and most supported for whatever reason it may be. No one's to decide but you, because you're the birthing woman. and you need to be feeling like you can completely let go, and whatever will be, that you will be held in that space. So for you, this is a hospital setting, and that's perfectly fine. Now, then there's an exercise, and I will share a screen now. Actually, that will be the easiest. We go through this exercise, and this exercise we did when I underwent my doula training. And this is imagining your labor and the birth of your baby as if you were the baby. And it's sort of flipping the perspective and asking yourself, well, if I was to do it again, if I was to go through my own birth again, which it might prompt you to ask your mom about your birth story and really tap into that.
Yes.
And saying, well, how would I do it again? How would I do it differently? What would I like? Who would I like to be there welcoming me into the world? What sort of vibe, what sort of energy I would like? So what sort of words come to you? You know, what sort of what is the known to start with? What is known in terms of your support team? Who's going to be around you?
Yeah. Well, I think, yeah, talking to my mum about how things were back then, and we've sort of talked about that a little bit over the last few weeks while I've been doing some birthing classes, and she's been watching those as well. And then talking to her yesterday about my actual birth, I think something that's changed since I was born is that a lot of women are empowered to learn more about what to expect and what's going to happen to them, whereas I think for her it was just kind of get told. you don't ask questions and that sort of thing. So she didn't have the opportunity to sort of make any of those decisions or choices or whatever in the same way that we get to do now. So I guess if there's going to be something different, then maybe that would have been nice for her to be able to do that.
Yeah.
But at the same time, she lived in a small town, and I was delivered by the doctor that she saw all the way through. And I think that's much harder for us to get here now unless we're in the private system. And that was something that I thought about choosing for myself, but it just wasn't affordable for me at the moment. So, but I guess what I've then learned since then is that, I guess my reasoning for wanting to have that from that doctor was that I had an existing relationship with him and I trusted him. And then, going through the classes, how important it is to be able to, that I guess the best birth outcomes are when you're with people that know you really well, and when your support team, whether that's, I guess, the medical support team or doula or your support person, when you've got somebody there that you trust, that's probably the most important thing. So I think that she probably did have that. Probably just didn't have, and she was 23. She probably didn't have the knowledge of what was to come, or the opportunity to have her mother there or something like that. And she may not have chosen that, but I guess there weren't those options. She did say that her parents were away when the time came, and so things didn't necessarily go exactly to how she might have chosen for herself if she had things different. But I guess on a general level, I still would want that pregnancy to be just, fairly smooth and uncomplicated and natural. So I don't think that changes too much. So.
Yeah, definitely. And in the current scenario, I know who are you able to have at the moment with you, and who have you chosen to have with you?
So I'm able to have one person with me, and that's going to be my sister. Originally, I was going to have my sister and my mum, but logistically, it's much easier to have my sister. She's local. Mum's in Shepparton. It's much harder in the current climate for that to change. And for the most part, I think that that's really important to have her there. We're just navigating at the moment, though. My wants for the support that I would like for her to be able to give me versus what she thinks that she should be giving me and how she's choosing to give support. So there's a bit of a disconnect there that we're working through.
And this is going to be so useful to work through this for yourself first, so then you can clearly communicate to her what that is like for you, right? Because what I take away from all my training and observing birth is that you've got to let go, to completely just soften and open up and let go into birth, into your own birth of your own baby. You've got to let go of all the logical stuff. So you've got to completely trust your team. Like, that falling exercise, when you're falling, you've just got to like completely trust that that person's going to catch you from behind. I'll give you an example. I have a situation that with my personal health, I had a breast lump, right? This is a while ago. And I took my now husband with me and I said, you're my support person. We're going to see a specialist, but I've got a plan. I just need this from the specialist. I need you to be completely on my side. Do not hinder the confidence that I've got in myself. And we came to the specialist, and the specialist said, I think we should take some drastic measures. And I said, look, I don't want to. This is my plan, ABC. And my partner at the time, Aaron, he panicked, and God bless him, but he said, Anna, maybe you should do what the doctor says. So it sort of, it hinders the confidence or that sort of self-empowerment, completely different to birth scenario. But if someone sort of doubts your capability or has even a tiny little bit of something going on, it can translate into the environment. And it's just so weird. Like it doesn't even have to be a spoken thing. And I've seen this again and again. And what happens is, birth doesn't stop, birth will go on, but it can delay the process for a little bit. And it's sort of like in that stage where there potentially is a bit of a delay or back and forth conversation, the momentum drops of those beautiful hormones working smoothly and flowing. And all of a sudden, the woman's brain is more into the logic part, the logical part switches back on, and it sort of becomes a little bit of an interruption. So this is why we have these exercises and discussions ahead of time to clear the air, to make sure that we're all in this trust bubble, this trust circle, and that we can, if we need to fall, that we really will be held in that space. So does that make sense?
Yeah, that's the part that's tricky for me at the moment, is that trying to get across that the reasons for me wanting for her to do the learning that I'm doing and to watch the things that I'm asking her to watch is so that I can keep myself in that in the moment, and that I don't have to go back to thinking for myself, and I don't have to ask for what I want, that she is aware of all of that so that I can stay in that good place where my hormones can do what they need to do. And I think that's the difficult part to convey at the moment, is that she kind of wants to base it on, well, that's not what my brothers did, and that's not what this person did, and I'm trying to say, but that's fine, and I understand that in her mind she's helping me by doing the things that she's chosen to do. But what has been difficult is to be heard, that this is what I would like you to do because this is what supports me and why it supports me. And it's, well, you just tell me what you want. And then I'm trying to say, but I'm asking for you to hear this from the person who can explain it better than I can, because that's what they do for a living, and this is the background that they've got, and that they've seen all sorts of sides of what's gone well and what hasn't, and what are the, I guess, best outcomes for less stress labours that progress normally and naturally, and keeping people out of their prefrontal cortex, and working with the limbic system, I guess. And they're here to hear that from that person who explains that really well, so that you can then understand the context behind what I'm asking for when I talk about what my plan is. And that's kind of the hard part. It's still very much based on her idea of this is how I think that I can help you best, and you just need to tell me, and you'll just need to tell me at the time. And my whole point is I don't want to be I don't want to be looking after what somebody else needs to be doing. I need someone to be making suggestions to me and reminding me that I need to stay in that space and in that moment, and stay out of my head at the time.
Definitely. And as much as you can communicate with her now and brainstorm with her, or even direct her to resources, this is going to be very helpful for her, like you said, to hear it from a different party.
And that's what I'm trying, but that's where we're kind of getting this wall of, no, I don't want to do that, you're asking too much, because I'm doing all these other things. So
maybe this resource will be a very subtle way of discussing that. Perhaps. So
I'm parking it for a week until I've kind of gone through this, and I've got another little workbook that I was kind of going to go through and just, cement things for myself, and then just go back and say, I really want you to watch these ones because it explains this really well. So
perfect. That's awesome. And, if you look at the atmosphere, say we've got everyone on board, our immediate circle is completely on board with what we're trying to achieve and what you're trying to achieve as a birthing woman. And how do you imagine your atmosphere? What do you see, hear, smell around you, Rebecca? What's going to really hit it for you that's going to help you drop into your body?
Yeah. So I've got my my aromatherapy diffuser ready to go, and some of the oil from Inner Clarity. I think that my sister-in-law had that, so she's given that to me. So I'll have that with me, and like the bracelet and things. I sort of hadn't really thought about that much until recently. I kind of was just thinking, oh, well, you'll turn up at the hospital and what will be will be. But, I think now it's good that I can ask for things to, the lighting to be dim, and, things to be calm and relaxed in that way. So I think now it's just about me being clear when I speak with the midwives about what I would like, that if we can kind of go about things in that way, I think that's important. Being in the hospital itself doesn't worry me. I'm familiar with hospital environments. I've worked in hospital system. So that's, I don't feel like it's something that will necessarily cause me undue stress, but I am, I guess, now more confident about staying home for longer and being able to sort of labour on my own for a little while, in terms of, having my own bed and shower and space and stuff like that during the early phase, and then to sort of go in there and hopefully be able to kind of set things up. I'm making a playlist for my music, and I kind of think, well, I'll that would be the thing that I would listen to through the day or night, whatever, whenever it happens, but also in that sort of moment as well. I've talked about whether I do have my mum there through like Messenger or Zoom or something like this, because then she can be, she was really looking forward to being involved in the process as well, and so maybe that's a way that we can still share some of those moments.
I really love that idea, especially if you've got a strong bond and you really lean on her for that encouragement, and if you think she's going to be the sort of person who's really going to lift you up. I think that's a brilliant idea.
I just, I really appreciate that she hasn't tried to tell me her story. And even when I asked about it yesterday, she said, "Oh, you don't need to hear all of my horror stories, just create your own."
Mindful of you. Yeah, great.
But she answered the questions, but only to an extent. And then she said, "But this isn't relevant." And she, no questions asked, has just gone, "Okay, yep, I sent her the link to the birthing classes that I've been doing, and she's been sitting there and watching it all and taking it in and thinking about it." So, she's trying to support me how I'd like to be supported. So, which is good.
That's awesome. Sounds like you're really you're gelling there. That's I get a really good strong feeling behind that. And I think, on a practical level as well, like, we can definitely set it up for our emotions and how to feel safe in the space. But also, practically speaking, going to the hospital, I would pack a pillow or two extra. There's always a little shortage of pillows going around. Double check if they've got a spare feed bowl there, a yoga mat, stuff that, practically speaking, is going to be useful. And most of the time they do, but I think it's good to have that handy as well. And setting the scene of yourself, maybe your favorite scarf, or even if your mom can't be there, maybe a piece of clothing from her, just something like a familiar scent or familiar part of her that can be there with you, because it'll just give you that little bit of more strength, more emphasis on what she's gone through and how she came out the other side. So that'll be, I think, a really nice idea, especially hearing about your bond with her. And so then you already started talking a little bit about that first stage of labor and going through most of that at home, which is lovely to hear. I think that's the way to go. Recently we've started talking about how to prepare your body, and certainly there are medical ways that this can begin, but right now we're going to use all the time in the world. And I usually say to women, time is your friend. Even if we get to 40 weeks, time is still your friend. It's on your side, because a healthy full-term pregnancy can go up to 42 weeks, and that is okay. We do consider hospital policies because every hospital is a little bit different. But at home, I know we talked about, I know you won't mind sharing, we talked about, how we can stimulate hormones naturally. We talked about things like perineal stretches and nipple stimulation. And is it something that you've already tried in terms of expressing colostrum?
No.
No. So it's something that you can do even from now on, but you can do it closer to labor as well, and that helps create more oxytocin in your body and really brings those beautiful birthing hormones in. Definitely.
Things at the moment with being home on your own and going through this is that lack of physical contact, which how that sort of goes as far as oxytocin, having those extra boosts that you might normally have from having someone in, even being able to spend time with with the other people that you love, that getting hugs and that sort of thing. It is one of those things.
Yeah, definitely. I think definitely it's a challenge of its own kind at the moment. And I think you've got to, gosh, it's so unprecedented. It's so we probably took it for granted before.
Absolutely.
Go and visit a friend or do a movie night or cuddle, cuddle to our loved ones.
Yeah.
But certainly with your own contacts, you can, if you can create a space where you safely can, relax your body and go into the state of sensuality, that really is helpful. So you can, I think the earlier you can start practicing, and almost like this meditative experience, the the better, because you can train your mind into it. And so if we talk about medical intervention, I know we've discussed, delay of any medical intervention at this point in time, but usually they would start with a gel or maybe stretch and sweep, where they manually disturb the cervix with their hands. The midwife would perform this, or your obstetrician. But thereafter, they usually try the gel first, and then they talk about breaking waters. And then there is the syntocin. But if you went to 42 weeks, say maybe even 10 days over, and they're talking about that, what's your view on that? Where are you sitting?
Yeah, I guess I'm wanting to have that conversation with them this week about where they stand on things. I know when I was seeing the obstetrician that, his opinion was I won't go past 40 weeks because they don't allow that with women over 40, 41. And I guess, I'm sort of hopeful that it doesn't have to be like that. But I guess I do want to know more about what they would be recommending and what their reasoning is for that, as in terms of going beyond. Because I know that there is stuff out there about, I guess, the way that the placenta ages, I guess, or develops in older mothers. So I want to be able to take all of that information on board, but I also want to be able to give my body the opportunity to do this for itself. So, if there was any reason that I could be shown at the time as to why they would need to do things differently, then I'm prepared to consider it.
Yeah.
But I also, okay, chronologically, yes, I'm older and all the rest of it, but I also think that I've been relatively healthy and fit. I've done everything that I can from well before conception until now to prepare my body and, my mind to be able to kind of do this. And, some of the challenges that I had with getting pregnant were not because of my body, was because I didn't have the relationship situation to sort of have that opportunity. And I think that helped with the whole process, is that I always believed that there's no reason why it wouldn't work for me, that it just hadn't been tested. And I feel like it kind of should be the same. I've had a non-complicated pregnancy, like I have aches and pains and been tired and things like that, but really on the scale of things, it's been very straightforward. Things like my thyroid function has been better than it's ever been throughout the whole pregnancy. My pelvic floor function's been better than it's ever been throughout the whole pregnancy. So there's no reason why my body can't do this, but I'm prepared to at least, I guess, consider the options if I need to, but hoping that I have the opportunity where it's not required, and that they'll sort of allow me to have some choice in that.
Yeah, most certainly. And as the labour progresses, Rebecca, then with the conversation, we've got to consider the monitoring, and monitoring can go up. It usually is encouraged in the hospital setting to have a monitor that it potentially is mobile. But not always a mobile monitor will be available. So I'm talking about fetal monitoring, and it's sort of like a belt that sits across the belly and measures baby's heart rate. Also, if that's not able to be attached to the woman, they will come in and regularly check with a Doppler for heart rate and measure your blood pressure as well. So is that something that you know a little bit about?
Yeah, and look, that sort of monitoring doesn't particularly bother me. check my own blood pressure regularly. So I'd be very surprised if it did go up, and if it did, well, then I know that that is an indication that something needs to happen. It's not going to make me, I don't think that it's going to make me stressed by testing it. To me, it's just another measure to see if my body's responding in the way that it's expected to respond. And I would do the same as an exercise physiologist with exercise. So that I don't think that bothers me. Having the external monitoring, obviously I want to do as much of it without intervention as possible, but also if that's that external monitoring is the thing that means that I am allowed to continue on my own for as long as possible, then I think that that's fine, because obviously if the baby is in distress, then I do, I am obviously prepared to take the, make different decisions for myself. I would like to hope that just having that monitoring isn't going to increase my distress and therefore increase their distress. And, it's something that they can do without necessarily having to disrupt me from my own, I guess, headspace, or not even with my own, I guess, hormonal progression or, progression.
Yeah, most definitely. And I think the main thing that I observe is what I find that if a monitor goes on, and if it's not a mobile monitor, the restriction is how mobile you can be, how much you can move around. And if you're thinking about active labor, you're probably more restricted to the bed, to the hospital bed there. But if the mobile monitor is available, you really, it's fine. However, it can come off its little place there, and they can keep sort of poking you around a little bit to try and adjust it and stay in place. So it's a little bit give and take. So if you don't want the monitor, what happens is every 15 minutes or every 20 minutes, someone will be measuring your baby's heart rate and your blood pressure simultaneously. So that's something that I've observed, and that was interesting. I think as long as you're in your bubble and you don't have a monitor and they just do their thing, you can keep going. As long as you get into that rhythm and your support person can prompt that, let the woman have her breather before you sort of start doing that, and you get into a bit of a rhythm with that, for sure.
And I know that if my blood pressure starts to go up, then I know that that's something that they need to deal with, because my blood pressure didn't go up in a maximal stress test. My blood pressure stays low, unusually low. So I know that if it goes up, that there's definitely